Hello, it is Christmas cup season from Starbucks. I don't get Starbucks as frequently anymore because I am obsessed with this sugar-free white mocha from Gourmet Latte. Anyways, I am Dr. Allison Feldt, owner of Body Motion Physical Therapy, owner of AF Wellness Coaching, and your host of the Aligned and Elevated podcast. I am super glad you're here with me today. It's actually going to be a short episode. I'm about to see a client in 25 minutes. I have sent 3 of my providers that normally work on Fridays to an amazing American Shockwave Institute certification to get them certified in musculoskeletal shockwave. And granted, we do most of our regenerative therapies with for women's health, and we have innovated them. I decided I wanted them to have like top-notch end of best skills possible from a musculoskeletal range too. We do see a lot of women's kids here, essentially because my daughter is super active and all the girls on her team are growing a lot, going through puberty, and they're getting injuries too. So when I say shockwave therapy, we do regenerative tools here at my clinic in Edmonds. We do radial pressure shockwave. We are going to add in a focus shockwave, which is a deeper shockwave, which is it's more pinpoint changes versus having a wide range of change. And then we also use EMTT, which helps the tissue push out inflammation and helps pain recovery and erasing pain essentially. So it's kind of this these magic healing, literally medicinal tools to help your cells regenerate and to help tissue regenerate. So I have to tell you this story because I'm on this pathway of how can we get the body to heal as much as humanly possible? I want everyone that can possibly avoid surgeries to avoid surgeries. I myself have been trying to avoid a bladder surgery for, I don't know, the past 20 years. I've had a bladder prolapse for a long time, and it changed with children, especially because my first 2 births weren't as ideal as possible. You can go read about them in my pregnancy era book, but and I'm sure I've done episodes on them too, but I'm not going to dive into those today. But those essentially had a huge, terrible impact on my pelvic floor because I didn't have the proper birth prep. I hadn't invented the proper birth prep yet. And now that game has changed and we've totally innovated the type of birth prep and pregnancy prep that women need to go into childbirth. My 3rd birth was much better from a pelvic floor perspective, and my prolapse did not worsen, thankfully. So that is just a side note I'm sharing with you. But essentially what I'm trying to do is I'm trying to, as much as humanly possible, create recoil of my pelvic organ prolapse, of my cystocele. And I want to do this naturally. I do not want to get bladder mesh. I don't want to get a bladder sling. These surgeries don't look pretty. I've seen tons of them, and some of them I'm they didn't even fix your stuff, man. Okay, I'm glad your symptoms are a little better, but this is just, I think they couldn't be more perfect of a surgery, right? There's a 40% success rate anyways, and a lot of times it's because the symptoms were actually coming from the pelvic floor and not the position of the bladder itself. But I digress. So I'm super invested in getting the body to heal from it for itself. And so this is a little bit of a random episode. Bear with me here for anyone who's just a fan and likes to know about my life. It's kind of fun for me to just share with you. But anyways, so I am going to take you in a different direction. I have had a chronic fungal foot infection since my 2nd child, and essentially I have dove into why is this not healing? And there's a lot of hard drugs I could take to get this to go away, and I'm not really into those hard drugs, but so I haven't done that yet. But what I have done is I got my root canal removed. I went down this whole path of holistic healing of fungus, and I'm oh, I have this root canal. And actually my root canal had to come out because it was super infected. So they were either going to do another root canal or just do an implant. And I was I don't want another root canal, because then I started reading about these chronic low-grade inflammation just from keeping the dead tissue in there. And whether you believe that or not is whatever. But I was fully infected in my root canal and from the inside the root. So I didn't really want to risk it again. I'm let's just do an implant. I got set up to get a ceramic implant. I don't have it in yet, but I had the extraction. So I go in yesterday, and I found this super holistic dentist that takes swabs of the plaque on my teeth or of the tartar on my teeth and gives looks at the bacteria that's in my mouth, the good bacteria, the bad bacteria, and sees how active they are, just to make sure that the mouth is really, really healthy. It's a preventative approach. So if you have chronic cavities, this is like that prevention. They're called, it's in Bellevue, it's called Brilliant Smiles, I believe. I don't know. I can link into this podcast who they are. So I go yesterday and he's like, I get my implant, I get my extraction, the tooth extraction. It was relatively not complicated and easy. I did a whole bunch of EMTT on my jaw before the surgery and after the surgery, just to really help facilitate healing. I also did a bunch of red light to facilitate healing. And so I want to say that probably helped. But I then went back to get my teeth cleaned and also just see how the implant is doing. So, or how the extraction is doing, so I can get ready for the implant surgery, because I'm getting a ceramic implant, which is different than the titanium one I have. And so he's like, okay, it looks good, everything's good. But what we saw in my jaw is that I'm actually having like significant recession on one of my tooths right next to my other implant. And he's like, honestly, you need a tissue graft. The tooth is really healthy, but it's recessed, and that's how a tooth can die. And I'm like, okay, well, should we just take the tooth and do an implant? He's like, no, let's try to save the tooth. I need you to go get a tissue graft and put new tissue down there. And I'm like, where do you take this tissue from? And he's like, from the top of your mouth. And he's like, don't let them do an allograft from a cadaver, like really use your own tissue. There's a high failure rate with this surgery, so it's actually not even guaranteed. And I'm like, you're really freaking selling it, man. And not to mention, then I also have to drive an hour and a half to get the top surgeon that he knows that does this surgery. And so I am really not sold on it. And I'm like, come on, isn't there anything regenerative? Can't we do PRP there to get the tissue to regenerate? And then I'm like thinking to myself, I didn't say this to him, but I'm like, can I do focus shockwave there? Like, can I intraorally do focus shockwave? Can I do radial shockwave on my jawline to see if I can get any tissue regeneration? Can I do EMTT there to see if I can get cellular proliferation and tissue regeneration and build new cells so I can get new tissue to migrate to cover up that root? So he'd probably say no, and there's probably like zero research, but you know this bitch, I'm about to try it because I want that. I want this naturally. So I'll probably get the consult for the tissue graft, but at the end of the day, I don't know if I want to go through that. Like, my number one concern, honestly, is like, okay, so we have a 3 out of 7 fail, right? Or 3 out of 10 fail. And we have how many days am I gonna have to miss my workout? What's gonna happen when you pull that tissue off of the roof of my mouth? Something's gonna be affected. That's gonna pull on my vocal cords. That's gonna pull on my ear. There is something that is gonna have to compensate for that, like the fascial tension. So anyways, here's me just trying to be holistic, avoid surgeries. And the reason I'm sharing this on the podcast is because this is just real life. It's just the journey of trying to do things holistically, take care of my body, and be natural about it. I think there's other ways, and also just to have that general consensus and knowledge that like everything is connected. Everything in your body is connected, and you know, it's our job to take care of it, and it's also our job to use our intuition to take care of it. I want to leave you with one thing before I cut this episode. I know it's going to be a short one today. And again, it's all over the place, so hopefully you found some value that you can add to your life from me sharing this information. But I worked with this new intuitive medical medium, and she did a whole reading on me, and we found it was super insightful. And when I was talking to her, she's like, she's like, to lean into talking to your intuition more. She's like, you're super intuitive, and she's right. Like, I can read people's bodies like the back of my hand. When you walk into my treatment room, I magically just see everything that's going on, and I can treat you, and like you will leave feeling better. And so like I know I have that ability, and I can see the patterns, and that has been like kind of my secret sauce, honestly, behind starting Body Motion. And so she's like, okay, you have that ability. She's like, but you need to learn how to talk to your intuition more, just from like a personal life and like leaning into it. And I have really leaned into that over the last few years. But what I noticed and what I have done since talking with her, and she wrote the book Healing from Within, and her name is Katie Beecher. She's absolutely amazing. I'll link her here too, and you can go book a consult with her. And she was like, you just like have a notepad, and when you have a question for yourself, like write it down. So for me, like, it's like, okay, this is the tissue graft. Like, does Allison need the tissue graft? Like, intuitively, what is my body saying? My body is saying, like, yes, there is a problem here, and let's do everything we can. Like, I'm gonna try focus shockwave on it just to see if I can regenerate any tissue. And so you're talking to your intuition, and you ask yourself and your intuition these questions. And so I really have leaned into that. Like, I'm trying to, I love doing my self-care. My self-care is my magic sauce. Like, I am doing EMTT twice a week minimum. I do shockwave probably every other week to once a week, depending on if I'm having any aches and pains in my body. I do pelvic floor physical therapy at least once a month. I'm getting massages probably a couple times a month. I go for acupuncture, usually once a week, honestly. I get a chiropractic adjustment once a week to every other week. Like, I do a lot of things to take care of myself. And so it was like really good for me to be able to talk to my intuition, because I can now write it down and be like, what else am I not doing that would be supportive for my health right now? And some of the best hits I got when I was doing this exercise was, Allison, you actually need to sleep more. You need to sleep more so you can have more recovery and you won't be as high stressed or ramped up. Now, for me, a lot of my stress is like excitement, high energy, good stuff. And so I love that about myself and love that for me. But it also can be like a little overwhelming and a little bit all consuming. And so I got to pull myself in. I got to reel myself back a little bit. And talking to my intuition was one of the best gifts that I got from Katie Beecher. And I'm going to do another session with her. And there's a whole bunch of other stuff that I unveiled about myself just by learning how to talk to my intuition and like really trusting it, that I am not ready to share yet, but it is pretty magical how this all works. And so if there's one thing that you want to start playing with today, go buy her book, Heal From Within, and like just do the section on like how to talk to your intuition. Because if you're not listening to your intuition, that's, it just makes life hard. And I think one of the ways that I have built this business so successfully, I want to say, is because I have built this business, yes, on spreadsheets and yes, on money and yes, on numbers, but like 100% based on soul, intuition, and just heart, right? And so I have followed my heart and my intuition in the realm of building this business, which is not something that the books are going to teach you. And that's also how I've dove into my health journey, is like solely based on intuition and like what feels good in my body. So I hope you found, I hope this was some kind of lesson that you can put into your toolkit and maybe take that intuition lesson and be like, what else do I need to do for my body, my spirit, my soul right now that is gonna be supportive on my path? Like, your path doesn't have to look like my path, but we talk a lot about pelvic floor healing and pelvic floor health. Talk to your intuition and be like, am I doing enough for my pelvic floor? Am I doing enough to support my body? Am I doing enough to support my deep core right now? Because if I'm not, these are things I should consider implementing so I can move forward with a stronger core, with more support for myself. And let's be real, when you open up your pelvic floor and you start getting blood flow into your root chakra, into your pelvis, into your sacral chakra, you move differently. You have different connections to your intuition. That's what we're all looking for. And so when we can live life from that intuitive place, it makes our decisions a lot more comfortable. It makes there's no way you can go wrong when you're listening to your intuition. And so I hope you find this helpful information. I'm Dr. Allison Feldt. Please like and subscribe, share this episode with your friends, and I wish you the best on your health journey, keeping your body healthy, keeping your spirit, your heart, your soul healthy. Let's get you in touch with that intuition. Let's start taking care of you today, because tomorrow's not guaranteed. Take care.